In this training session, we will discuss participants' rights, risks, and responsibilities. All people have value, dignity, deserve respect, and have the right to make choices in their lives. This is the PDS universal value. Please keep this in mind when communicating with participants and their families. In participant-directed services, there are two types of roles. The PDS Service Advisor or Case Manager's role is to assist the participant and the representative with whatever they need help with. The participant and representative's role is to direct and, in a sense, be in charge of their services. As the person at the center of the support circle, the participant has rights, risks, and responsibilities. They have the right to choose a service provider. This can be a family member, friend, acquaintance, or whoever else they choose to employ. They also have the right to direct the development of their plan of care and their support spending plan. This means they should communicate to you all what they would like to get from the program. They also have the right to have a service advisor or case manager visit monthly and discuss their budget balance and any other issues that might arise. One of the main calls I get from participants are them complaining that their service advisor or case manager will not return their calls. The participant does have the right to contact you all with any questions 24/7. Now, though, this may not be feasible all the time, but please respond to them in a timely manner. Now let's discuss the risks. A participant also has the risk of being terminated if their patient liability is not paid. PDS services are not used for 60 consecutive days. Their health, safety, and welfare are jeopardized. They demonstrate threatening or intimidating behaviors towards staff. Their person-centered service plan is not being followed, or their budget is overspent and/or is being mismanaged. The participant also has responsibilities associated with being part of these programs. They have the responsibility to select a representative if desired or needed. Please note that all minors need to have a representative designated. If a representative is designated, then that rep assumes all roles, including the rights, risks, and responsibilities. The participant also has the responsibility to be present for all monthly visits and also partake in the discussions. They also need to work with you all to develop their person-centered service plan. It is also the participant's responsibility to sign the timesheets for the employees to submit for payment, and as an employer hire, train and schedule staff accordingly. The participant also has a responsibility to follow their person-centered service plan. In doing so, they need to be trained on how to coordinate their care and also how to manage their budget. It is also their job to ensure their employees are cleared through background checks, screenings, and also trainings that are needed, as well as making sure they are staying within their approved budget and service hour limits. The participant also needs to identify their natural supports. Natural supports is defined by a non-paid person's primary caregiver, or community resource who can help provide or has historically provided assistance to the participant or due to the familial relationship would be expected to provide assistance. This can be parents, spouses, children, etc. The participant also needs to manage their employees and ensure their timesheets and service notes are documented correctly. Their signature is needed on these, so they need to be aware that should be reading these and not blindly signing off on them. If a patient liability is applicable, it also the participant's responsibility to make sure this gets paid, as well as maintain their eligibility for Medicaid. Let's move on to what the representative responsibilities are. These individuals act on behalf of the participant for the PDS program guidelines and are chosen by the participant. They must be at least 21 years old. However, HCB2, the age is 18. These representatives need to be present for monthly visits at least once a quarter. There are situations a while back where a representative was unexpectedly hospitalized and missed their monthly visit for that quarter. The support broker needed to know if they should issue a CAP or not. In that case, we instructed them yes, the CAP needed to be completed because they had 3 chances to meet that monthly quarter visit. Representatives also cannot be paid to act as a representative or provide PDS services to the same participant. Please keep in mind that the representative is in control of all aspects of the program. Do not have a representative appointed just to be a figurehead. This program is geared for providing the necessary services for the participant, not just a paycheck for the guardian or whomever is pulling the strings and calling the shots from behind the scene. You all as service advisors or case managers can empower or undermine representatives. You need to make sure that they stand firm when speaking to these individuals and also to participants and guardians when it comes to the operations of PDS. Clearly identify who is to perform what duties, which will help reduce confusion and misuse of PDS. Also, please note, guardians who work for participants may struggle with allowing participants and/or representatives to perform their employer-related duties. It is strongly recommended these guardians be asked to make difficult decisions regarding their roles and duties and stand by their decisions. Speaking with employees or other members of the participant's team can cause the representative to lose interest or investment in assisting the participant. Thank you for your attention while we briefly discuss participants' rights, risks, and responsibilities. If you have questions or concerns, please call Dale at 502-564-6930 or send an email to dale.pds@ky.gov.